Good morning from Southern California. This is Dr. Anthony Chang of AI Med. I'll be talking about COVID-19 and artificial intelligence, how pandemics will be eradicated in the future with artificial intelligence. This is the third of a series of 5 videos. If you haven't had a chance to look at the previous videos, this is a continuation of the video series. So this is the third segment on current strategies of COVID-19 by different countries and what's working, what's not working. So when you look at current strategies of global health and COVID-19, first we start with containment. And I consider this sort of avoiding the war. So it's the epidemiological version of avoidance. So this is simply identifying individuals that are infected, put them in isolation and quarantine to avoid an epidemic. So this is a nice graph showing you in light purple here what containment can do in terms of decreasing the number of cases over time. This curve next to the containment curve is if you were to do no acute intervention. We'll talk about other strategies in the next few slides, but this is containment to avoid the epidemic or pandemic in the first place. The next strategy in the spectrum is mitigation, and you hear about this in the news quite often. This is what I consider a retreat. So it's the epidemiological version of a retreat during a battle or war. So this is a strategy to focus on slowing the spread and lowering the risk of infection to the point where the vulnerable individuals are going to be accommodated by a stressed health system. And you're seeing a lot of sad pictures and videos of health systems being stressed from Italy as well as New York City. So the mitigation strategy is isolation of suspected cases, encouraging everyone to perform personal hygiene measures, and then social distancing of high-risk individuals. Now, what's confusing is sometimes the suppression measures also are included in the discussion of mitigation. So suppression is kind of a stalemate from an epidemiological perspective. So this is designed to stop or even reverse the pandemic by reducing R0. R0 was previously discussed as sort of the contagiousness of the infectious agent. Now you want to reduce R0 to less than 1, which means every single person that's infected cannot infect more than one other person. So this is so that the pandemic can be mitigated further than mitigation. The disadvantage here is that the infections can recur because there's no true herd immunity unless vaccines are available. So this is more serious than mitigation. So the measures include distancing of the entire population rather than just a segment. Schools are closed, crowd events are banned, and lockdown of area of the region or even the whole country, like as in Italy. So this is a nice bar graph. I'm borrowing from my relative who happens to be working in the CDC. This is talking about containment, mitigation, suppression, and prevention. And you see on the graph a nice depiction of the different strategies. So there is actually some overlap of these strategies. The bottom line is the earlier the intervention and the stronger the measure, the more effective the strategy overall, and the less time required for these interventions. On the other hand, the later the intervention and the weaker the measures, as we're seeing in some countries, the less effective the overall strategy, and the higher number of deaths, unfortunately, we're going to be seeing, and a higher case fatality rate. So this graph shows you that mitigation doesn't always work like what you're hearing from the pundits on TV. Only suppression pretty much guarantees a flattening of the curve. So mitigation oftentimes alone may not be enough. So we were all curious about the entire lockdown of the Wuhan quarantine, and you can see the empty streets and lack of pedestrians. So China had to impose a historically harsh quarantine because the initial containment strategy had failed. But other countries like Singapore, Hong Kong, Japan, Taiwan, and South Korea have really found the nice compromise or sweet spot between implementing public health measures and strategies, excluding a draconian quarantine while maintaining economic stability. So this is my grading of different countries. I think Singapore, South Korea, and Taiwan get an A from a public health perspective. China gets a B because of the lack of disclosure of the initial outbreak. And I think countries like Italy, Spain, and the US are getting C's because of lack of testing that was effective at the beginning, and also lack of sufficient mitigation and suppression measures. And hopefully the point of care testing from the US and other countries will make up for the difference and help to save lives. So this concludes the third video in a series of 5 videos on COVID-19 and artificial intelligence.